Good afternoon. I'm Nikcoli Silva from GPH 56. My topic for today is regarding the problems associated with bad posture. I'll be focusing on some very common problems that all of us experience on a daily basis, which are directly linked to bad posture and also as to how we could get rid of them. So posture is simply a position of the body or the arrangement of the body parts relative to one another. And even though the term posture sounds very simple and some of us might think that we already know what posture is, but actually the reason as to why I chose this topic today is because during our clinical presentations at the physiotherapy clinic, the physio, we notice a lot of patients who are receiving treatment, they come with chronic neck pains, back pains and shoulder pains. And most of the time, the underlying cause, the root cause for all these problems is the bad posture that they have developed due to their sedentary lifestyles. So the effect of posture on health is becoming much more evident nowadays. And not only can posture affect on your physical body, it can also affect your mood, your self-concept, and also how others perceive you. So posture is something that's becoming more powerful than previously thought. Therefore, it can be said that good health starts with good posture. So what does this term good posture mean? So as you can see in the diagram, it means that your bones are properly aligned and your muscles, joints and all the ligaments are working as they are supposed to, as they are intended. It also means that your vital organs are in the right position and they can function with peak efficiency. So most of these musculoskeletal pain, which is related to posture, is due to the imbalance in the body or when the body is out of alignment. So what happens is when the body is out of alignment, some of the muscles are overworking while the others are not performing its specific function. So this creates stress and a lot of pressure on the muscles and also their accessory structures which would lead to pain with time. So by simply correcting your posture and by regaining balance and alignment, you could actually improve your work efficiency. So moving on, I would first like to start about the sitting position because that's what most of us do except for when we are sleeping. And I'm pretty sure that most of us are quite familiar with the pictures which are displayed on the screen at the moment because these are the positions that we are adapted to. We are mostly in a slumped or a slouched position, and it's because we feel more comfortable that way and we feel that it requires less effort from our muscles and as the body from the whole than sitting upright. But researchers have shown that prolonged sitting in combination with these awkward postures such as slouching and slumping, it can cause many health conditions and mainly it's an underlying cause for low back pain. So why and how does this happen? So you all know that the vertebral column, it has three natural curvatures, right? So in the cervical area, the lordosis curve, thoracic kyphosis, and in the lumbar area, again a lordosis curve. And also, our body, the pelvic, it has a natural pelvic tilt, which is the balanced position. So proper posture with regards to sitting is the ability to maintain a neutral lordosis position as shown in the picture as well as a natural pelvic tilt. So it takes off a lot of pressure from off your spine and as well as from your back muscles which can reduce low back pain. But what we do according to the postures that we have adopted, what happens is our pelvis is tilted backwards or posteriorly. So along with this backward pelvic tilt, it pulls the vertebral column backward as you can see in the diagram. So this is the type of spine, this is what happens. So when it pulls the vertebral column, there is a reduction in the lordosis, the lumbar lordosis. So it causes flat back. And also due to slouch and slump positions, thoracic spine, there's an increased kyphotic curve because our shoulders are always hunched. So these are musculoskeletal related abnormalities that would cause us sitting positions. But studies have also shown that prolonged sitting is associated with at least 24 different chronic diseases. And experts say that even for people who are otherwise active, sitting alone can be an independent risk factor for chronic diseases like diabetes, cardiovascular disease, and even kidney disease. So simply, the more you sit, the higher your risk for chronic health problems, not only these conditions as well as musculoskeletal problems. So considering all these factors, let's see what we can do in order to reduce these problems and at least to a certain extent. So first of all, when you are sitting, you should make sure that your back is fully supported, right? And your back rest should have a certain angulation, and it is best if you could use a lumbar roll to maintain your natural lumbar spine, the curvature. And the angle between your upper body and the lower body as shown in the picture can vary from 90 to 100 degrees and also the angle between the knees should be maintained at 100 degrees. And if you are working, maybe since all of us are using laptops, the simple thing that we could do is the eye level should be in line with the laptop. So we can use a few books at least to raise the level of our laptops, and so that our head is maintained in a neutral position. And when you are not working, it is said that the best angle to sit is at an angle of 135 degrees, because this is the position in which this is the optimal position in which the natural pelvic tilt is maintained. So apart from this, what else could we do? These are the postural alignments that we could do. When you are sitting, you shouldn't sit for a really long time. Always when you are working, make sure you take breaks in between. Work for 45 minutes, take at least a 30 to 60 second break, and do a few stretches. Those I will be explaining later. Another important thing, cross-stitching. So this is something that all of us do, despite of being a female or a male. It might look good, but do you think it is good for your health? It's a definite no. So it's not something that I'm saying. Research have actually proved this, and this study was conducted to identify the postural changes in adults, including both male and female, and who have adopted the habit of sitting with their legs crossed. So this indicated that sitting with legs crossed for more than 3 hours, it causes many adverse effects, such as one thing is it causes the lateral pelvic tilt. That is, whichever leg you are crossing over, that hip is actually in a higher position. So it tilts your lower back, making one side tighter than the other. And also, prolonged sitting, it can cause your inner thigh muscles to shorten and your outer thigh muscles to become long. So what happens is it puts your joints at risk of moving out of place. And now you can see in this picture about shoulder inclination. Now in the first picture, it shows he's seated with uncrossed legs with feet flat on the ground. So you can see how the neutral position is maintained and how the curvatures are maintained, including the shoulder inclination, with no shoulder inclination. But in the second position, he's seated with legs crossed at the knees. So you can see in green, they show the deviation and the shoulder inclination that occur. And when you consider the third, that is 1 foot up on the knee, that is how men say, there is a significant amount of shoulder inclination as well as the deviations from the natural spinal position. Not only that, the cross-legged sitting could actually increase your blood pressure as well. And it also, the studies have also shown that it could increase your risk of developing varicose veins. So I think it's best for all of us to stop sitting with our legs crossed, and instead we could keep our legs flat on the ground and sit up straight. And another common postural abnormality among us, due to the repetitive use of computers, video games, and even the usage of backpacks. We might not notice it, but we always tend to tilt our head forward, and even when we are watching TV. So this has caused a syndrome which is known as the forward head position. So you can see the difference in the pictures, right? First, in the first picture, the normal curvature of the spine, the cervical spine is maintained. So ideally, if you take, the head should sit directly on the neck and the shoulders, like a golf ball sitting on a tee. So the forward head posture, what happens is there's a loss in the natural curve of the spine, and it places a lot of pressure on the joint. Okay, so holding it forward out of alignment puts a lot of strains on your neck and your upper back muscles. So that leads to muscle fatigue and muscle pain, as well as tension headaches. And in addition to this, it has also shown that it causes a risk of disc herniations, early arthritis, and pinched nerves. Texting, something that all of us are guilty of. So we are always texting and looking at our smartphones with a slumped position, with our shoulders hunched, arms bent, and fingers tapping away at the screen. So this has led to a syndrome which is known as poor smartphone syndrome, which is also known as the text neck. So just like the forward hip position, it too creates a lot of stress on your neck muscles. So I'll tell how it creates. Now see, and the average adult head, it weighs about 4.5 to 5.4 kilograms, right? So that is at 0 degrees flexion. So you can see in the diagram clearly, when your flexion, the degree of flexion increases, the weight of the head increases. At 60 degrees of flexion, the weight of the head is approximately 27 kilograms. So that's a lot of pressure on the spine. So make sure next time when you are using your smartphone to raise it to your chin height, so that your natural cervical spine, the curvature is maintained, and your shoulders are not hunched, and your neck is not bent forward. And just like in sitting, you should always take breaks. Do not use it for a prolonged time. Take at least use it for 45 minutes and take at least a 5-minute break. Moving on to a little bit about our professions, that is as nurses and physiotherapists. Maintaining good posture is very important, starting from greeting a patient to treating a patient. Because especially in nursing, it requires a lot of proper biomechanics when it comes to lifting and transferring patients. So one of the chief complaints among nurses is prolonged standing. So what you can do if you have to stand for a really long time is always maintain a wider base, right? And try not to stand for a long time in the first place. And if you have to, make sure you shift your weight from one side to another, right? And you should try your best to maintain your natural cervical curvatures, and your pelvic alignment should be always neutral. So now I'm going to demonstrate a few stretches that all of us could do when we are working. Work up to 45 minutes, take a break, and do a few stretches. So Shamila and forward head position, something that you could do is, so all these exercise stretches, you could hold up the neck mounts and repeat 3 times or so. So the first thing for the forward head position, you can do the chin tuck, right? And for your neck exercises, neck muscles, you can do lateral movement. Yeah, these look simple and these are stuff that you know, but actually these are the stretches that even at the clinics we recommend for the patients. So flexion and extension, and for the trapezius, upper body. And for the low back. And for your gluteus muscle. So these are very simple exercises. You can just pick them up. So try to include these in your daily routine. Thank you. So I think it's good to say that posture is actually just as important as eating right, exercising, and even getting a good night's sleep. So good posture is a way of doing things with more energy, less stress, and less fatigue. So let's all try to maintain a good posture and be